Hi, my name is Renaldy Hernawan. I'm from Lampung University, Biology, and I will explain you a little information about COVID-19 in Indonesia. COVID-19 or coronavirus disease 2019 is an infectious disease caused by a new virus called SARS-CoV-2. This disease first identified in Wuhan, China. At the end of 2019, the virus widely spread over many countries, and then in March 2020, WHO declared COVID-19 a pandemic. This disease attacks the respiratory system. COVID-19 also makes people who get infected experience several symptoms. The common symptoms are fever, dry cough, and tiredness. Some also experience itch, sore throat, diarrhea, conjunctivitis, headache, and loss of taste or smell. Meanwhile, the serious symptoms are shortness of breath, chest pain, and loss of speech. However, there are many who don't experience symptoms. It takes about 5 or 6 days to the symptoms show. However, the incubation period takes 14 days. People who have mild to moderate illness usually can recover without hospitalization. Meanwhile, those who experience serious symptoms have to seek medical attention. The virus spreads through the droplets when infected people sneeze or cough. Therefore, WHO gives the way to prevent infection such as washing hands regularly with soap and water, avoiding touching face, covering mouth and nose while sneezing or coughing, staying at home, refraining from smoking, and practicing physical distancing. COVID-19 is an infectious disease caused by a newly discovered virus named SARS-CoV-2. This virus first appears in Wuhan, China, and eventually spreads in many countries, including Indonesia. In Indonesia, the first case of COVID-19 reported on March 2, 2020. After WHO declaring COVID-19 a pandemic, all the activities such as working and studying are done in homes. However, the case of novel coronavirus keep growing. In the end of March, the total case in this disease reached 1,528 cases. To respond to the pandemic, UNICEF has been leading efforts with the government in the World Health Organization and other partners. The President also issued regulations regarding the pandemic. Government Regulation Number 21 in 2020 is issued to regulate the large-scale social restriction or PSBB and is implemented in coordination and collaboration with various parties in accordance with statutory provisions. 2020 is the year of COVID-19. Indonesia feels the enormity of this pandemic. Various aspects of development. The Indonesian economy during the year slowed down to -5% in the second quarter of 2020, and in the aggregate growth was -2% in 2020. The target of development planning in the National Medium-Term Development Plan 2020 was researched through the updating the government work plan in 2020 with the main priority of overcoming COVID-19. Then development began to be intensified in 2021 to pursue national priority targets that were abandoned due to COVID-19. The 2020 state budget allocates around 937 trillion rupiah for the prevention of COVID-19, including the accumulated APBD 86 trillion rupiah, which makes the deficit financing for the year reach 1,226 trillion rupiah. The COVID-19 pandemic control policy through large-scale social restrictions policy has had ups and downs, especially when coupled with the new normal policy. The policy for limiting micro-community activities as a substitute for PSBB was implemented in the early February, and the parallel national vaccination program is expected to support accelerated development as outlined in the RKP 2021. In 2021, the COVID-19 pandemic is still high in the world, and the acceleration of development proclaimed by the government gets a stretch of road then extend to be traversed. The world faces an unprecedented global health and socio-economic crisis triggered by the COVID-19 pandemic. In Indonesia, the lives of millions of children and their families have already been upended. Lockdowns and school closures are affecting their education, mental health, and access to basic health services. Since the first case of COVID-19 was reported in Indonesia, UNICEF has been leading efforts with the government, the World Health Organization, and other partners to respond to the pandemic. Oh, I almost forgot to tell you guys about how to protect yourself from COVID-19. The first step, you must get vaccinated and stay up to date on your COVID-19 vaccines. COVID-19 vaccines are effective in preventing you from getting sick. COVID-19 vaccines are highly effective in preventing severe illness, hospitalizations, and death. Getting vaccinated is the best way to slow the spread of SARS-CoV-2, the virus that causes COVID-19. CDC recommends that everyone who is eligible to stay up to date on their COVID-19 vaccines, including people with weakness immune system. Wear a mask. Everyone aged 2 years and older should properly wear a fitting mask indoors, in public, in areas where the COVID-19 community level is high, regardless of vaccination status. Wear a mask with the best fit, protection, and comfort for you. If you are in an area with a high COVID-19 community level and are age 2 or older, wear a mask indoors in public. If you are sick and need to be around others or are caring for someone who has COVID-19, wear a mask. If you are at increased risk for severe illness, or live with or spend time with someone at highest risk, speak to your healthcare provider about wearing a mask at medium COVID-19 community levels. People who have a condition or are taking medications that weaken health immune system may not be fully protected even if they are up to date on their COVID-19 vaccine. They should talk of their healthcare providers about what additional precautions may be necessary. Time and health are two valuable assets that are not recognized and valued until they are lost. Health is the connection between you and your body. Health is not luxury, health is cheap, but it becomes expensive when health is turned into diseases. When you walk into an operating room, you realize how precious health is. So always take care of your health, love your closest people, and don't forget to worship. Okay guys, that's all I can say. And I hope my explanation is understandable. And I'm sorry because my English is not good. Bye.